Thank you for tuning into Reality TV and Behind the Candidates. I'm Ray Bakari. This is one of two virtual discussion with the candidates that Ryan Lukowicz and I are doing during this year's Rhode Island primary elections. We decided to cover one state Senate and one state House primary that we both find interesting and are on the radar come election day in September. For the House side, we have both of the Democrats running for House District 16 having agreed to do this. The first is State Representative Brandon Potter, who was first elected in 2020, and he's being challenged by Joseph Graziano. And for those tuning in, this district is located in the city of Cranston. Now, candidates, you'll both get 1 minute closing statements at the end. You can respond and fact check each other however you like. We just ask that you don't talk over each other so we can keep the conversation productive and flowing. And if it does get out of hand, or either you are not answering a question directly or taking too long, Ryan and I will interject. We'll also have a lightning round portion of questions a couple of topics in. Ryan will kick things off with our first topic, which is the state budget.
Hi, Raymond. Thank you. Yes, we will have 5 topics, and I will kick us off with the budget. It is expected next year that there will have to be reductions in programs coming because of a deficit, as revenue forecasters have predicted. Mr. Potter, we will start with you on this question. It's a 2-part question for our base question, and then we will ask follow-ups as needed. So the question is, first, what are your thoughts on the price tag of $14 billion for this year's budget? And assuming that number will be lower next year, what programs will have to be eliminated as a result? Or what programs do you want to be eliminated as a result of that price tag being lower? So we'll start with you, Mr. Potter.
Well, first, I want to just say thank you to both you, Ryan, and Ray for hosting this. And I want to thank Joe for participating in it. It's kind of common conventional wisdom and advice in politics that when you're an incumbent, you don't give airtime to your opponent. But I am a firm believer in democracy, and I'm happy to participate in this. And I thank you guys for putting it together. One thing about the budget I want to say is people hear that $14 billion price tag, and it can be a little bit misleading because a big part of that is money that we get from the federal government. And so much of that budget will depend on what happens in November with the presidential election and whether or not Democrats are able to maintain control of the Senate and hopefully win back control of the House. But with that, I think the most important thing that we can do as a Democratic Party in Rhode Island is to make sure that all of the gains that we've made with very critical, supportive social services do not get cut. In particular, the first thing that comes to mind for me is Medicaid. We have done a really effective and powerful job of raising Medicaid reimbursement rates, which were so needed to stabilize our healthcare workforce and the care that people get. So if there are inevitable budget cuts that come down the line at some point next year or in the following years, really what we need to do is we need to explore what kind of aid that we're giving to commerce and other kinds of projects that are not ultimately all that necessary to maintain a very safe and effective social safety net to protect the most vulnerable people that we have in the state.
Okay, Mr. Graziano, what are your thoughts on this?
So over the past few years, we've seen the state budget expand, and for good reason, right? Rhode Islanders far and wide are in need of support, and we've relied heavily on new programs and budget initiatives to address those issues. I think the key thing moving forward is that with the budget diminishing, we still have new initiatives that we want to introduce. And we need to be watchful for 2 things: that we're not taking on more than we can handle without further burdening taxpayers, and whether the programs, new or old, are actually delivering the intended results for Rhode Islanders.
Some say that the governor should have a line item veto power in the state's budget in order to cut down on so-called pork spending. Mr. Graziano, I'll start with you on this. Do you support or oppose that?
I oppose the line item veto. I just don't see enough support for it in taking on. I mean, this budget goes through the General Assembly each year, gets passed over to the Senate, and then back over to the House to present to the governor. And then it comes right back to the General Assembly. We're only going to create more issues if we kind of let go of that process as it stands.
Okay, and Mr. Potter, I want to give you the opportunity to respond to that question and add on or respond to anything that Mr. Graziano said if you want to address it.
Yeah, I don't think that a line item veto is really all that effective, truthfully. I understand why a lot of people think that, but with the majorities that we have in the House and the Senate, it is fairly easy for either chamber to override a governor's budget veto. So in the event that, you know, we enacted the power to the governor for him to do that, I think it would just probably delay a lot of initiatives from ultimately ended up in the budget anyway.
And without getting too much into the minutia of the specifics, there was a big push this year from retired teachers to get their COLAs back. You know, a plan laid out wouldn't have them come back until 2030, when some of the teachers, you know, may be dead and not able to receive those at this point. I'm curious, Representative Mr. Potter, we'll start with you on this. What are your thoughts on the COLA restoration plan to kind of phase them back in based on what year you were retired into the budget?
Well, I think the first thing that you have to recognize are the people who we're talking about who are not getting these COLAs are people who worked under a contractual agreement for decades. This is something that they were promised. And these are retirees who have now planned their later years in life on fixed incomes expecting to get this. I think it is an absolute travesty that we cut these COLAs to begin with. I am very pleased that we made some progress on it this year, but quite frankly, it's not enough. I talk to a lot of retirees in my district. I hear a lot of really heartbreaking stories of people who are really, really struggling to make ends meet on money that they expected that they would get. So while we've made, you know, a little bit of progress on it this year, it's important to those people. We've got to do a lot more on it. And as always, any budget item, anything that we're investing in financially is a statement of our values. And I can't think of many things more important than protecting our seniors and workers who worked for a very long time under a promise that we need to deliver for them.
Mm-hmm. So just a quick follow-up on that, Mr. Potter, is this something that you would want to push leadership to be more in support of more dramatic reforms in the year to come? And how do you go about convincing people like the Speaker, you know, House leadership, or even Senate leadership into you know, supporting that?
Well, you do it the same way that we did it this year, right? We have a budget caucus every year that comes later in the session. Of course, like, we're all having our collective priorities and we're all lobbying the Speaker and leadership in both chambers for the things that we think should be in the budget and other bills that we think need to be passed. But when it comes time to make that final case for what kind of items you want to see included in the budget, that's what we did. I was one of the people this year that got up in the budget caucus very early, argued for Medicaid rate reimbursement rates to be raised, argued to reinstate COLAs. And we heard a lot of really passionate arguments from many of my colleagues who shared very similar heartbreaking stories from people in the districts who were struggling. So I think it's that kind of collective action, making sure that you can organize people in the chamber, bring in advocates on the outside to make sure that their voices are heard, and that you prioritize things like this as your collective ask.
And Mr. Graziano, do you think you could be a better advocate for you know, seniors struggling in House District 16 with their COLAs? And how do you feel about the restoration given this session?
I think it's the right thing to do. I've had family members and friends who were affected by this. You know, there's a need for a stable pension system that is managed responsibly. And in order to restore some of those lost items, we need to ensure it's done responsibly. And so that we also don't find ourselves in that problem again. So I don't want to overpromise, but I think getting to that goal of restoring those promises that we made years ago to those Rhode Islanders and their families is important.
Do you think you could be a better advocate for residents in House District 16 who care more about this to get more dramatic reforms next year?
I do. I think I can be a voice for those folks, a louder voice, if possible, connecting with different legislators to get this done.
Mm-hmm. We won't lament on this, but Representative Mr. Potter, would you like to respond to that?
Yeah, I mean, I kind of find it interesting the contradiction that I inherently heard in that. It's a matter of getting there is what I heard, like eventually getting there. I mean, the people that we're talking about who need these COLAs are of age, right? A lot of these people are elderly. They don't have time for us to just wait to get there. One of the things that I've said since I first ran is that I believe that our state government needs to act with urgency. Of course, we're a part-time legislature. A lot of the lack of progress that I would want to see happen ideally happens because we have a bottleneck effect by being a part-time legislature. But it really takes people who are very loud, who are not afraid to speak truth to power, who are going to continue championing those things and really push the anecdotal stories that we hear that really resonate with people when you talk about how heartbreaking it is for these people. So I will say I was one of the most passionate people in that budget caucus that argued for COLA reinstatement. And quite frankly, some of the things that we heard from other colleagues were that there's a sentiment and there's a belief among these retirees that we're just waiting for them to die. That's an uncomfortable thing to say out loud, but that we're just waiting for them to die so that we can fiscally do this appropriately. Well, if we really need revenue, I can think of one particular way that we can generate revenue, and that's by making the people who earn $1 million or more pay a little bit more in taxes. I think it is inherently unfair that when we're talking about budget priorities and people who are living on fixed incomes, that we are talking about not getting to deliver for them something that they were promised at the same time where we're not willing to say people who make $1 million a year pay a little bit more in taxes than people who make around $140,000 a year.
I want to bring Mr. Graziano in on this to respond to what you just said, Mr. Potter, and also Mr. Graziano, since your opponent brought it up here. Do you support a so-called millionaire's tax, which I believe has been instituted in Massachusetts as well?
It has. I don't want to overpromise and underproduce when going to the legislature. And the reality is with a shrinking budget, it's going to be a lot more difficult to kind of make those moves in restoring those pension reforms. But I think we can generate a pathway to do so realistically. With regards to the millionaire's tax, to me, the issues with taxes are far more nuanced than the haves pay more and the have-nots pay less. I think there's a lot of different levers we can pull in order to help those who need it. It's easy to say that we can get more in taxes, and with the more available to us in monies, we can implement the programs that we want to see. However, I'd rather just see more taxpayers in general. And what is the correct set of levers to pull in order to make that happen? With regards to the millionaire's tax, I'm hearing from those in Northern Rhode Island that some folks from Mass are coming into the state just for that reason. So I think maybe developing a study commission to take a look at the different effects a millionaire's tax has had on Massachusetts, and in response, what's happened to Rhode Island since then.
Okay, thank you, Mr. Graziano. Mr. Potter, I'll let you get the last word on this before we move on to Ray for our education topic.
Yeah, I don't know what Joe is hearing from people in Northern Rhode Island. I'm talking to people who live in Cranston, which is in the center of the state, and I'm hearing from people who have children who can't afford to live in Rhode Island, and they're leaving the state. So I don't hear about a whole lot of people from Massachusetts or other places coming into Rhode Island because they're getting taxed too heavily in Mass. I hear about people who cannot find adequate employment here, people who cannot afford to buy a house here, and they're leaving the state. So again, I think it's telling that if you think that you can be a better advocate for these retirees or any kind of working class person to begin with, but at the same time, you don't want to overpromise and underdeliver, and you're not willing to make the wealthiest people here pay a little bit more in taxes so we can see some of these things actually get implemented and deliver for people, then that, to me, says everything.
Okay. Mr. Graziano, would you like to respond to that? I'll give you like 10 to 20 seconds.
Sure. If those folks who we potentially end up taxing leave our state, then those monies are gone. And then now we have less at our disposal to provide the services and programs that Rhode Islanders need.
Okay.
very, very common, counter argument that we've heard for years. There's been a number of economic studies on this. If you look at other states that have implemented this, they have not seen those millionaires leave the state. People who are here and are earning $1 million plus a year are here because their employment is attached to Rhode Island. And quite frankly, if anything, in other states that have done this, you've seen the reverse effect where more people have come into the state because of what those states have been able to do in terms of their public infrastructure and social safety nets.
Okay, I think that's a good place to end things for that topic before we litigate it any further. I'll take over now for the next topic, which is education. It's a multifaceted issue, so we have a lot of subtopics we can cover, but I'll give it an interesting one to start things off with. So starting with you, Mr. Graziano, say you're elected to represent District 16, January comes, the speaker asks you, what's one bill that we could pass right now to improve educational outcomes? What would it be and why?
Certainly the free breakfast, free lunch program. That's something we're seeing given adequate attention now with our current vice presidential candidate in Governor Walz. Folks have been pushing in this direction for some time now in the Rhode Island General Assembly, and I'd like to assist in those efforts. I think this type of program ensures our kids have adequate nutrition to get them through a school day, and is conducive to learning from our teachers. And it's one less worry for parents, and I know that for a fact, as I have 3 kids in the system now.
Mr. Potter, you've been elected for a couple terms, but if there's one that you've introduced before, I'll let you. Same question.
Yeah, I've co-sponsored that bill every year that I've been there. It's a bill that I strongly support. Of course, like all of this goes down to money, right? And ultimately, whether it's passed in the budget or it's a standalone bill, it's additional resources for schools. I think taking a look at other ways that we don't have to totally override the education funding formula, but we can just increase categorical aid for certain programs, I think would be really helpful. What I'm hearing from a lot of parents and from a lot of teachers is that we need more school counselors, we need more teachers assistants, we need more creative programs for children with IEPs. We need to better integrate children that have learning disabilities. There's a whole lot more creativity that I can think of and imagine that we fund very particular programs that would go under categorical aid. And I think those things would really improve educational outcomes for all students.
I'm glad you brought up the funding formula because that's another big topic when we talk about education in our state. There's a lot of people who say that it needs to be restructured or reformed. Looking at Cranston, where this district is in, I'll stick with you, Mr. Potter, for this, and then we'll let you go after Mr. Graziano. Based on the current way the funding formula is, do you think Cranston's getting enough amount from the state?
Well, listen, you were going to have a hard time finding any elected official who says, I don't want to have more money for my school district. But the big conversation that happens in the State House every year is whether we change the funding formula and we come up with something new. And that is not something that I do support because, quite frankly, Cranston is a big beneficiary of the current funding formula. We're seeing around $80 million a year now in state aid. That is massive in comparison to many other municipalities. And I think by really changing that funding formula, you open up a risk that Cranston would not get the resources that we really need. Truthfully, and I'm sure Joe will probably agree with me on this too, we really need the city of Cranston to step up a little bit with their education funding. We have a current mayor right now who has level funded his proposals every year. Those cuts are, and that's what they are, they're cuts. Let's be clear. If you're talking about level funding anything, especially with the rate of inflation that we've had over the last couple of years, that is a cut. So it takes partnership on both the state and the local level. But in terms of the state funding formula right now, I do not want to see that get touched.
Mr. Graziano, how do you feel about the way it's currently affecting Cranston?
I think similar to what Rep. Potter said, I think making some necessary tweaks to ensure that Cranston's getting the best bang for their buck is important. But I do think this is a local issue that we need to take a look at and working with our municipal leaders on getting that funding to our students. 23 schools in Cranston, and we need to stay in communication and make sure those Cranston families are heard.
Now, it sounds like you both are in favor of reforms. Sticking with you, Mr. Graziano, any specifics that come to mind?
Not currently, no.
What about you, Mr. Potter?
Well, again, it's all about dollars and cents, right? So it's a matter of increasing funding, but targeting it. The one thing that I'm really hearing a lot, again, from parents and teachers is that the additional resources are not there. Programs that would support children with IEPs, kids with, learning impairments, having more school counselors in there, having more mental health professionals in there. We've really come a long way in understanding all of the factors that go into educational outcomes. And I think targeting money on programs that focus on those efforts, it will be the most effective thing.
Anything you want to add, Mr. Graziano? Okay, so now it's Cranston specific one. Starting with you, Mr. Potter, there's been some changes and realignments to the school bus routes in the city. This is more of a local one, but since the district's in Cranston, I want to get both of your takes on this. One of the changes include no more transportation to and from child care centers. Do you have any thoughts on the changes to the bus routes?
Yeah, I think it's, again, another reflection of the current administration and a lack of transparency in how this administration operates. This was a surprise to people. People were really shocked when this came out. And while we're having a conversation up at the State House about how we make sure every kid that's in school can have every opportunity to succeed, whether that's paying for free breakfast, free lunch, adding additional money, that takes those kids actually being in school. And pulling the rug out from parents, out from students, quite frankly, out from the entire school system is really unconscionable and inexcusable.
Mr. Graziano, any thoughts on the changes to the bus routes?
No, I didn't understand the logic in which that process was created and that implemented. It's aggravating because just getting there for a lot of families is difficult, and to add that kind of burden onto them just further makes it more difficult to be a student in Cranston.
Okay, seems like a little bit of agreement so far on some of these topics for education. One that's also been a big topic in recent years is whether we should have a constitutional amendment to guarantee the right to an adequate education in the state. Starting with you, Mr. Graziano, where do you stand on that type of proposal?
Yes, I do. I think it's important that, there was a push to engage young folks in our government. And to do that, I think providing that buy-in through a constitutional amendment is important. They have a right to a good education, and the benefits of doing so will only further getting monies to our schools.
Mr. Potter?
Yeah, I definitely support it in theory, right? I can't think of many things that would be more important to a young person than having a legal right to an education. I do have a lot of caution when we talk about opening up constitutional amendments, especially when we're having a conversation right now around whether or not we should have a constitutional convention. The prevailing wisdom is that it invites massive dark money from many outside of Rhode Island groups, where we're in the context right now of having a lot of right-wing organizing around pulling away our rights. So I think when we have that conversation, we do have to put it in that context. We do have to be careful. And quite frankly, I think we can do a lot of work inside the General Assembly to make it where every kid actually realizes a right to education, rather than just have something that's written on our Constitution that we're not able to deliver on and open the state up to further litigation in the future.
Kind of further pin that down, though, if it were, say, introduced and it gets a floor vote, how would you vote?
I would vote in support.
Okay, so now moving on to another part of education that, we could talk about K through 12 all day long, but higher education is also a big topic in our state, especially when you talk about other factors like brain drain that the state's suffering. You're both actually RIC alumni, so this is actually a fitting question. The Hope Scholarship, it's been extended, and the results are currently appearing to be positive for RIC. Mr. Potter, how do you feel about how that's been going so far with the Hope Scholarship?
Yeah, I want to mention that you're also a RIC alum, Ray. And we first met at RIC, and it was one of the first interviews that I gave with you over there. Yeah, I mean, listen, I was thrilled when we passed that. I was thrilled when we funded 2 years at CCRI as well. We have to understand that for many people to get ahead and have a fair shot in this economy, it takes a college education. There's also other, alternative pathways with people who go into vocational trades, and we need to support those things too. But seeing to it where every kid in Rhode Island that wants to get a college degree can do that without having to go into massive debt is a huge priority for me. And as a CCRI and a RIC alum, it was a really special moment for me to see that get put into law.
Mr. Graziano?
I'm fully for it, seeing the positive results from the Hope Scholarship. As a person who unfortunately didn't get to benefit from that, folks that I grew up with, to remove that type of burden from folks in order to receive a quality education, can also keep some of those folks in our state, which is important.
Now, currently it just funds the last 2 years and there's some contingencies. Would you favor, sticking with you, Mr. Graziano, would you favor maybe one day extending it to all 4 years at RIC?
I would love to do that.
Mr. Potter, how about you?
Absolutely.
And then there's also this conversation when we talk about free tuition, like the RI Promise and Hope Scholarship. What's going to happen with URI? Does URI get something like that? Mr. Potter, do you think we should do something like that for URI?
I don't think it's really necessary at this point, because URI has a benefit that Rhode Island College doesn't have. And that's where a lot of students from out of state are going there and paying tuition. So while I would, love to see where every state college in Rhode Island offered a free 4-year degree to every Rhode Island student, I don't think that it's pragmatic right now. I don't think it's most necessary. And I think we can expand the scholarship at RIC before we start looking at URI.
And what would you say to someone who says it's not fair for URI to not get in on the having that type of benefit and free tuition program?
Well, I would say it's not fair to students who don't have, or prospective students who don't have a shot at getting a high quality education here without going into massive debt. And we have to start somewhere. And, for most of the people that I'm having conversations with about that, they get it. They agree. There's not a lot of, good faith contention and argument on the other side that doesn't recognize the unique position that URI is in as compared to Rhode Island College.
Mr. Graziano, should there be a free tuition program at URI?
No, not at the moment. I just don't see that being feasible. But what we do see is folks from CCRI or RIC working to transfer over to that school and building their resume and saving up money to take on the advantages of going to URI, because it's a great school.
So the questions I have, sorry, go ahead.
Right, I just wanted to add too, and if we're really going to look at subsidizing more education at URI, there is a conversation right now about whether the state of Rhode Island should have a state medical school to try to tackle our primary care physician shortage here. And if that's something that we can work in and see some long-term value, if we can incentivize people to study medicine at URI and stay here and practice in the state, then that's something that I think can lead in that conversation. But certainly that's a very long-term project and would take a lot of study before we get there.
Before we move on to lightning round, since you brought it up, how do you feel about the proposal to have a medical school at URI?
I think it takes a lot of vetting. I think we really have to look very strongly at it. We obviously know the issue that we have. We have a major shortage of primary care physicians. I'm not sure that just the amount of medical debt that doctors are coming out of school with is the driving force there. I think a lot of it has to do with the reimbursement rates in parity with neighboring states. There's a lot of other factors that go into it. So I think it's going to take comprehensive study.
Mr. Graziano?
Yeah, I share in that.
All right, that's all I had for education. Now Ryan's going to take over the lightning round questions.
Cool. Thanks, Raymond. Thank you, candidates. And for this section, we are looking for obviously briefer answers since it is lightning round, but we will let you elaborate a little bit. So it's mostly, support or oppose type of questions with a fun one at the end. So there are 5 of these. Mr. Potter, I will start with you on this first question. Do you support or oppose an inspector general's office in the state of Rhode Island, which was proposed this year by many House Republicans and some Democrats as well?
I support it. I co-sponsored the bill. And I think, certainly just looking at the current situation with the Washington Bridge is a big testament for why it's something we should strongly consider.
Yes, we will loop back to that topic. Mr. Graziano?
I'm in support of it, but creating a whole new agency, especially one with oversight on spending, requires a lot of work, as Rep. Potter knows. So we need to have a significant plan with fleshed out parameters. It needs buy-in from just about everyone in government, and it needs to justify the spending on itself.
Okay, thank you. That was good. And next question, Mr. Graziano, we will stick with you on this. Do you support or oppose term limits for members of the General Assembly? And if so, how long would you like to see those term limits?
Yes, I do. And I'd say about 12 years, 6 terms.
Okay, for both the House and the Senate?
Correct.
All right, great. Mr. Potter?
Yeah, I think it's around the same time too. But I will say, not to give you a lot of agita here, Ryan, with belaboring the lightning round. But when we talk about term limits, one of the things that we have to really keep in mind here is that, most election cycles, the majority, or if not close to half, of state legislative seats go uncontested. So I think we really need to figure out ways to get more community buy-in, activate more people, have people take an active participation role in government before we really start talking about implementing term limits.
Sure, but would you, if the bill came up next year, would you support or oppose the term limits? And did you say you agree 12 years is a reasonable amount?
Yeah, I think that's reasonable. I do support it. I have co-sponsored those bills before too.
Okay. Mr. Potter, we will stick with you on this next question. Let's see. So the question, sorry, I'm just looking back at my
Constitutional Convention.
Yes, and Mr. Potter, I think I know your answer to this because you alluded to it earlier, but do you support or oppose the question on the ballot for this November to have Rhode Island, hold a constitutional convention? And for the listeners out there and people watching, just for background, this is something that hasn't happened since 1986, but would bring people together in order to change parts of the Constitution if they wanted to through a convention. So the ballot question is just if this would happen or not. So do you support that?
I do not strongly oppose it.
Okay. Mr. Graziano?
Strongly oppose it as well.
Okay, no elaboration there. Okay. Thank you. Next question, Mr. Graziano, we'll stick with you. This is a timely one considering Victory Day was on Monday. Rhode Island is the only state in the country to celebrate this holiday. Do you support keeping Victory Day as a holiday or changing its name or repealing it altogether?
I think changing its name to reflect the current generation. We're seeing changes right now in the State House where they're removing the Providence Plantations title from portions of the State House. And I think it's about time that we do the same thing with Victory Day.
Okay. Peace and Remembrance Day, that's the name I've heard most often. Does that sound reasonable to you instead of Victory Day?
Sounds very reasonable to me.
Okay. Mr. Potter?
Yeah, I support renaming it. I've co-sponsored the bill. I'm not sure that Peace and Remembrance Day is the right name for it, only because I've heard a lot from the veterans community that they're very opposed to it. And I think bringing them into the conversation so they don't take it as a slight and, they totally understand that we recognize their service and want to celebrate them along with it, I think would be helpful in renaming it eventually.
Do you have a name in mind that you'd like to see it be?
I don't.
Okay, no worries on that. Mr. Potter, this is our fun lightning round question. What is your favorite restaurant in House District in general, but bonus points if it's in House District 16, of course?
I'm gonna have to go with Chaska in Garden City. Indian restaurant. I eat there probably once a month. Fantastic food, great environment, great atmosphere, great service. Love it.
Good choice. I have eaten there once, which I'm from North Kingstown, so that doesn't always happen. Mr. Graziano, how about you?
I am a sucker for the Singapore noodles at Chen Garden off of Pontiac Avenue.
Oh, okay. I will have to check that place out. As we always say, Raymond and I need to go to these places with you guys.
We got a long list going of places we got to check off.
I know. It's a great question, and nothing brings people together like food. Raymond, do you want me to move on to healthcare?
Yep, that's the next topic, and that's your topic.
Perfect. Okay. Thank you, candidates, for being so willing to, be brief with those questions. Your cooperation is much appreciated, so appreciate your straightforward answers there. Okay. Without further ado, we will move into healthcare, a very important topic, and our base question does address something you brought up earlier with the physicians shortage. Again, it's two parts. Mr. Graziano, we'll stick with you to answer this first. Has the Rhode Island General Assembly done enough to make sure that Rhode Islanders are getting good health care? And how concerned are you about physicians leaving the state of Rhode Island at rapid rates?
I mean, we haven't done enough, to be honest. I think rising costs and availability continue to be a concern. I also think quality of care. There's so much work to be done on a litany of healthcare related topics. I think we could do a whole other debate, a whole other discussion on these types of issues. But I think it's about time that we pull up our sleeves and get some plans in place to mitigate some of those issues moving forward.
Okay. Anything specifically you'd like to see done in the General Assembly that you would sponsor bills about related to healthcare?
I think the availability of primary care physicians is a concern for a lot of Rhode Islanders, a lot of Rhode Island families actually, in making sure that our children get the care that they need, that our seniors get the care they need, and our veterans as well.
Okay. Mr. Potter, same base question, and feel free to elaborate on specific policy.
Yeah, Ryan, Ray, as you guys both know, healthcare is what I work the most on. I'm the vice chair of the Health and Human Services Committee. It's where I've focused the majority of my work. And I want to remind everybody that when I took office, we had an incredibly devastating, tragic crisis in our nursing homes where people were laying in beds without people there to take care of them. We've had children with developmental disabilities on wait lists where they can't get early intervention services, which literally change the outcome of their life. There has been crisis after crisis in our local healthcare system. We see that from primary care physician shortages. We see that from people not being able to access pharmaceutical medication. We see that from people not being able to see a doctor quick enough or get a referral quick enough. This is what I focus the majority of my work on. I'm really pleased that this year we finally raised Medicaid reimbursement rates that were recommended by the Office of the Health Insurance Commissioner. It's an effort that I've prioritized for the last 3 years. And I'm pleased that those things are going to make very meaningful change in the care for seniors, people in nursing homes, kids with developmental disabilities. But we need the Office of the Health Insurance Commissioner to do the same thing for primary care physicians. When you see a PCP who can literally just go and set up shop in Seekonk or Attleboro and make 30% more than what they make in Rhode Island, that is a huge factor in what's driving our healthcare shortage. So what that's going to take is holding the private insurance companies accountable and making them raise their rates so we're on parity with those neighboring states. It's also going to take an additional Medicaid investment so doctors will actually treat patients who have Medicaid. And at the same time, we've got to holistically try to figure out ways that we can reduce the overall actual cost of healthcare. And if you do a little bit of study on this, what you're going to lead back to is we've really got to take on the pharmaceutical industry and make them accountable.
Gotcha. Okay, Mr. Graziano, back to you. I know Mr. Potter spoke a little bit more about that. So I'll ask you a couple of more specific questions. How do you feel about the current plan to raise reimbursement rates? And then do you support what Rep. Potter proposed about getting the insurance companies to raise their rates to benefit PCPs?
I agree in both. Obviously, the work that has been done this past year through the budget was very important work. I believe the governor introduced Medicaid reimbursements over a 3-year period. It was reduced to a single year, which is a credit to the General Assembly, credit to the governor to kind of sign off on that. But also, as he said, holding the folks accountable in the insurance companies to allow for PCP primary care physicians to get started here in Rhode Island is super important.
Okay, and Mr. Graziano, just to elaborate on that a little bit, Representative Mr. Potter did point out, you know, he's an incumbent. He's the, you know, Vice Chair of Health and Human Services, says it's one of his biggest policy areas. So how do you think you could better address healthcare in your position as a state representative?
Well, I think it's focusing on working with other members of the legislature, of the General Assembly. I think connecting with folks on these issues and presenting them to leadership. I think he's done some work, but I think I could do more.
Can you elaborate on that, and then we'll get Mr. Potter's response?
I think having a great relationship with all of the members of the General Assembly in order to get things done is important. So kind of generating a coalition of folks to get that work together, present a plan, and getting it done is what's needed.
If I may interject just a bit, because I've heard you mention having a relationship with all members. Are you like pointing to maybe saying that Mr. Potter doesn't have a good relationship with some members? I just want to, I've heard that twice now, so I just want to kind of get an elaboration. And then Mr. Potter, I promise you'll get the next word.
Sure. I think, I mean, he's co-sponsored quite a few bills. A lot of those bills haven't passed. So there's reasons for that. And one of those reasons is that those bills aren't enough to get that over the finish line. So I think having a significant coalition of folks and not just working with a smaller group of folks to get things done is important. And that might require making some concessions on certain things. Being able to work with folks and find common ground is part of why you're up there. And I think it's important. Okay,
Mr. Potter, respond to that, please.
Yeah, I mean, that's exactly what I do. It's what I've done the entire time that I've been there. And Joe's right. You do need to find common ground with people that you disagree with on other issues. I mean, the first thing that comes to mind for me, my first year in there, Rhode Island was the first state in the country to pass legislation allowing safe consumption harm reduction sites. For the people who are watching that don't know what that is, that means that we will allow somebody to obtain illegal drugs somewhere else and go there and use them under supervision so we can prevent overdoses. That is a concept, when a lot of people hear it, they think it's very radical. It literally saves lives. And that's a bill that we were able to get done by having very conservative members of the Democratic Party in Rhode Island in the General Assembly support that and testify for it. But you know, I take note of the impression that I somehow don't get bills passed. One, it's misleading because I have gotten many important bills passed, bills that I've been the main sponsor of, bills that I've helped as a co-sponsor. But in general, there's a lot of bills that we collectively prioritize and help to get passed that don't have our names on them. And for me, the work that I do has never been about getting accolades or getting a press conference for a bill signing. It's about making meaningful change in people's lives and doing the work that people require our state government to do. I mean, just this past year, I co-sponsored a bill. It was one of my priorities through the Health and Human Services Committee that bans insurance companies from discriminating against seniors when they apply for a Medicare supplemental policy. That's not a bill that made headlines, but it's an important bill that affects people in very meaningful ways. I've passed bills and that have made their way into law to streamline prior authorization. So insurance companies can't stop patients from seeing a doctor when they need to, or can't stop insurance companies from just waiting until they approve a prescription medication for somebody. I've passed laws to remove co-payments and deductibles on HIV prevention medication. And
Mr. Potter, to interrupt, I know we could go on about the bills for a while, but I want to give Mr. Graziano equal time and the chance to respond to you about, you know, any of the bills, Mr. Graziano, that you've heard about, or just a general response. We won't belabor this, but go ahead.
Sure. I mean, the folks in the district don't know about that work because we're not talking about it and you're not communicating with the district the work that's actually going on. because some of these bills are the first time I've ever heard you working on them. So I think it's important that we're communicating with our constituents about the work and the focuses that we have.
Okay, I don't want to deviate too much from healthcare, but Mr. Graziano, just a quick follow-up. How do you think you would better communicate with the residents of House District 16 about bills that you're working on?
I think it's about keeping in constant communication with folks, not just during election season, not just when it's convenient or when a camera's in front. I think it's staying in constant communication with your constituents. That's important. It was something that was promised 4 years ago when he first entered office, and I just haven't seen it happen.
That was definitely direct, Mr. Potter.
Yep.
Well, yeah, I mean, it's the first time that I've ever heard anybody criticize me about not staying in touch with my district. My constituents know that I am one of the most actively involved people, not just in campaign times. I mean, I have town hall events. I send out a newsletter periodically. I send direct mail to my constituency, informing them at the end of every year bills that I've worked on and what we've gotten done and what my priorities are. So it's really a baseless attack. You know, I work very hard in the General Assembly. I'm somebody who takes the work very seriously, and I certainly communicate the things that I'm working on with people. And more importantly, I keep an open line and try to reach out to people to hear about the things that they are experiencing and what issues are important to them, so I can prioritize that kind of work too.
Okay, Mr. Graziano, last word on this?
I disagree entirely.
Is that it? Do you think that's all true about the town halls and such? And that's how the responsibility in his district?
I just don't see it happening. I mean, I live in the district. I don't see these town halls. I know he every once in a while will stop by the library to promote. I mean, he's got one on Monday that was just announced this past week. I mean, does that give your constituents enough time to be able to get to those events? Does it? Again, he said he does it beyond election season, but I haven't seen that.
Well, I mean, thankfully, Ryan, Ray, you guys can just go on my Facebook page. You can go on my social media. You can look back in prior years, and you can see when I've had those events. They're not always during election season. It's a matter of public record.
Okay, we'll put a pin in that part of the discussion.
Yeah.
I think we should ask about Fair Share for Dental Care Act and then move on to infrastructure.
Yes. So for the Fair Share for Dental Care Act, this is basically a bill that was proposed this year, and it allowed the basically dentists to get more money out of the hands of insurance companies, back to what we were talking about with regulating them. I believe 85% of the money ends up back in the pockets. Raymond, you can stop me if I'm explaining this wrong.
No worries, I can elaborate just a little bit. So to basically, it would ensure more premium money goes into patient care. The rate that was proposed in that bill was 85% of premium dollars actually go into patient care. It was introduced by Rep. McNamara in the House. I actually wrote up on this for the work because that's why I know a little bit about it. And then Senator Gallo in the Senate. And it didn't get across the finish line, but Mr. Potter, do you support it already? And if not, I mean, would you support it next session?
Yeah, I do support it. I do believe it was the first year that it was introduced in that fashion. So, I mean, it's totally normal for a bill to, be introduced 1 year and take a lot of crafting. And I will say again, anytime that we're talking about raising rates on private insurance, we do have to holistically try to tackle the root causes of what actually is driving healthcare costs. It's a complicated system that we have. Of course, I'm a believer that we should have a much more simple system where everybody gets the care that they need and healthcare is treated as a human right. But we are a long way away from that. But when I say that, what I mean is we have to be careful and cautious before we implement raises in insurance reimbursement rates, because those premiums get spread across to the entire insurance pool. And unless we're holding the people who are really driving the bulk of healthcare costs accountable, then we're kind of missing the ball a little bit. And that's the pharmaceutical companies. We've really got to take them on, and we've really got to actually lower the total cost of prescription drugs, and in turn lower actual healthcare costs.
And just to add on to it, Riot of the Rhode Island Dental Association also had a strong lobbying effort this session for that bill. And when I had covered this for the Beacon, they talked about how this could be one of the big ways in fixing the issue of dentists not practicing in Rhode Island and then fixing the other snowball effects from that. It sounded like there was a little bit of hesitancy. I just want to like pin it down. So do you support that type of legislation? Is there any critiques you have? And then after we'll let you get in on this, Mr. Graziano.
I do, and I don't want you to take it as a critique. Again, I'm just reiterating the fact that whenever we're talking about raising private health insurance reimbursements, that will raise premiums for everybody. So we have to balance that out so people don't stop paying for their private health insurance. People can actually afford to pay their premiums. And we tackle the underlying root cause of what is really making those premiums so unaffordable for so many people. And the bulk of that is the pharmaceutical industry.
Mr. Graziano, how do you feel about the Fair Share for Dental Care Act?
So while I'm not completely familiar with that bill, I think it's important that we workshop it as we do most legislation, taking a look at where we can make those tweaks that can make it something that passes the General Assembly.
And how about just the overall idea of like premium dollars not going toward patient care at a high enough rate compared to, say, Massachusetts, a neighboring state?
Sure, I think the more we put into patient care, the better.
Yeah,
I think
the biggest issue there, can I just add? The biggest issue there is when we're talking about dollars going into patient care, the burden on healthcare providers, generally speaking, is that the bureaucracy of the billing mechanisms takes up so much of their time. I mean, I talked to mental health professionals. Again, I passed a bill a few years ago that alleviated the burden that they would have from health insurance companies who came back a year plus later and said, hey, we paid you the wrong amount of money, give us money back, right? Our providers are spending so much time doing billing and working and fighting with insurance companies rather than being able to spend that time actually caring for patients. And that is a lot of the reform that I've been working on that we've got to continue to work on.
All right. I think that's a good place to end the healthcare discussion. And now moving on to infrastructure, which I'll take over. It's our final topic, and then we'll let you both get the 1-minute closing statements. So we can dunk on the road quality all day, but I think we got to talk about the Washington Bridge, especially with the big development that started today. We'll start with you, Mr. Graziano. I'll just keep this a bit broad, but today there was the announcement by Governor Dan McKee and Attorney General Peter Neronha that there's going to be a lawsuit against 13 companies over the failure of what happened with the Washington Bridge. Your initial thoughts on how that part of this is being handled?
I'm confident in the Attorney General's office in cooperation with the governor that'll hold those accountable who need to answer to that. And, this issue hit so many Rhode Islanders, commutes extended, interrupted, small businesses drastically affected, medical appointments, et cetera. This was a catastrophic problem for our state, and how we move forward will matter. And as we all know, it's clear our roads and bridges continue to need work. It's no shock to those of us that drive on them each day. But the need for real solutions are necessary to ensure something like this doesn't happen again.
Mr. Potter?
Yeah, I mean, the sheer cost of this bridge, I think, really needs to hit us all square in the face. The latest estimates are over $500 million it's going to cost to repair this bridge. Even with federal help, this is going to cost hundreds of millions of dollars charged to Rhode Island taxpayers. And we should be very clear when we talk about this, because something of this scale does not happen accidentally. This kind of failure can only happen from very deep-rooted corruption that Rhode Islanders have come to frankly expect. But moreover, this is not a victimless crime. I know we're all burdened by it. I'm burdened by it. The traffic, the small businesses in the area, they're all burdened by it. But the victims of something of fraud like this are much more widespread than what we see immediately. This money that we're going to need to spend to fix this bridge is money that we desperately need for things like healthcare, for education, for housing, for infrastructure that we need, like right now, for climate resiliency. So when things like this happen and we see failures of government to this extent, we should not accept it. We should hold everybody accountable. That doesn't just mean the contractors, that means the people who were charged with oversight of this all along the way. And we need to put some really safe protections in place so something like this can never happen again in the state.
And one thing that I heard, this is once the dust is settled and the post day of reckoning happens, this might still linger depending on if he's still there. But there's been some folks that are very vocal about RIDOT Director Peter Alviti needing to either be removed from the post or resign. Stick with you, Mr. Potter. Do you think he should remain RIDOT Director?
I'll tell you this, Ray. If I were the governor, he would not be the RIDOT Director.
Mr. Graziano?
I think you have to hold those in power responsible for the work that's being done. And if the work is not being done, if the evaluations are not coming through, we have to hold those at the top accountable, just as we hold those who are actively on the scene accountable.
But
Is
kind
that
of
a
to
yes?
circle back to what Ryan's saying, to circle back to the question, should he not be RIDOT Director anymore?
If there are issues found in his leadership in this situation, I certainly do think so.
So you don't have a stance on that currently?
No.
Okay.
I mean, Ray, I got to say, I don't know what the if is, right? If there are issues, we've got a bridge that is going to cost the state hundreds of millions of dollars, and we have really no accountability for it. I don't know what other if of an issue could pop up that would, be greater than what we're seeing right now in real time.
Mr. Graziano?
Sure, but if some of the issues that were happening in 1992 is indicated in some of the talk today, we're not going to be holding the folks who from that time were accountable.
Mr. Potter?
Well, I don't know of anybody that we have leading the Department of Transportation right now who's been there since 1992. Obviously, a lot of these inspections have happened in recent years. There's been a variety of contractors who have been hired to do this work. And we've seen a big shift towards privatization under Director Alviti and the way that DOT operates. And quite frankly, I believe that what we're seeing right now is the result of that.
All right, Mr. Graziano, last word, and then I got one more question, then we'll go to closing statements.
No, I have nothing else to say on that.
Alrighty. I do want to, since we're still in infrastructure, and obviously we can have the whole debate about the Washington Bridge debacle itself, but I do want to give a Cranston specific one because the city has seen some gnarly floods. I think Reservoir Avenues last summer, this recent one that was at Oak Lawn Avenue, like where that and the other avenue met under that like bridge area. That was like the car that was submerged in water with how bad the flooding was. Mr. Graziano, we'll start with you. As a state rep, what will you try to do to get that issue resolved in terms of floodwater infrastructure in the city?
I think it's important that we take on those issues. These issues have been going on for years and nothing's been done, whether at a local level or in the General Assembly. So we need to get folks over from DOT, from DEM to help figure out the opportunities in which we can mitigate those problems. Taking a specific focus on the problem areas that continue to happen. You mentioned the car underwater on Oak Lawn Ave. That happens every time we flood. There's not a car. There's a car every time a flood occurs there. The Reservoir Ave flooding, relatively not as old, something in the last maybe few years that we're beginning to see, but without any kind of work being done to help stop that, we need a louder voice.
Mr.
I don't
Potter?
think there's.
Oh, go ahead, Ryan.
If I could, Raymond, sorry.
Yeah, go ahead.
I don't think there's a lot of debate around if it actually happens in Cranston, but can you just be more specific in your answer about what the General Assembly should do? Do you have any specific ideas?
I think it's finding funding to actually work on those issues in those problem areas.
Okay.
Mr. Potter?
Yeah, of course, it's always money, right? But again, let's go back to where we started this conversation tonight. If you're not going to look for ways to draw revenue, and you're not going to consider making millionaires pay a little bit more in taxes to fund things like this, then, I mean, really, you're just making a promise that you're not going to be able to deliver on. I think what is most pragmatic right now for the state in the near term is we need a comprehensive statewide climate resiliency infrastructure plan. A lot of the work that we're talking about with climate mitigation is really focusing on the coast and the beachy areas of Rhode Island. But, I live in an area right near the Patuxent River, and I've got folks in my district who have experienced flooding in their homes. And in, one condominium development, the people on the first floor have lost everything. So we need some attention paid to that. We've got to really study how sea rises are going to affect not just people on the coast in Narragansett and South Kingstown, but how they're going to affect people across the state, Cranston being one of them. And we're going to have to really work with the federal delegation to get money to mitigate a lot of the effects of this going forward.
All right, that's all the time we have for questions. Now we're going to let you both get a 1-minute closing statement. Consider this, say, your elevator pitch to a voter in House District 16. Mr. Graziano, we'll start with you. You have 60 seconds.
For me, Cranston is more than just a place, it's a home. Our neighborhoods are filled with the laughter of kids, the dedication of hardworking families, and the spirit of community. As a father of 3 smart kids, I know how important it is to create a safe, vibrant environment where our kids can thrive. I've seen firsthand the strength of community, and I'm committed to making it even stronger. Our friends and families deserve a representative who's always available, someone who always listens and takes action on the issues important to the district. Together, I think we can address the issues that matter to most of us, from improving our schools to making our streets safer and supporting our local businesses and taking care of one another. I also believe in the power of unity and collaboration. And as District 16 representative, I would work tirelessly alongside the members of the House of Representatives to ensure that every voice is heard and every concern is addressed, no matter its size. I'm one of you. With that said, I humbly ask for your confidence and your vote this election.
All right, Mr. Potter, you have 1 minute.
Thank you again, Ray, Ryan, Joe. Appreciate it. I guess I'll just say this. Legislating is very serious work. Every year in the State House, we make decisions that are going to impact and affect people in very important ways. They're going to have those effects for decades to come in some cases. I think it's really important that we elect people who not only take that work very seriously and know how to move things forward, but people who are principled and honest and have the courage to stay true to their values, to actually speak about what their values are and speak truth to power when the need is there. I've never shied away from my values. I'm somebody who publicly says I support a woman's right to reproductive freedom. I support banning assault rifles in Rhode Island. And we have a context in Rhode Island where we have a Democratic Party that for many years did not support those things, and many people in the General Assembly still do not. I've showed my constituents exactly who I am. We've made a lot of progress since I've been there, and we've begun to build a state government that puts those kind of values into action. None of these things come easy. They always take a fight, and I've been on the right side of that fight every time. I want to continue to fight for people. I want to continue to build on the progress that we've made so far, and I'm anxious to get back to work in January. Thank you.
Thank you, Mr. Potter. That's all the time we have for this discussion with the candidates. Thank you again, candidates, for giving us your time for this. And thank you again for those watching and or listening to this. If you haven't already, please click the subscribe button down below on YouTube and follow the Behind the Candidates podcast on whatever platform you listen to your podcasts on. You can also find our discussion with the Senate District 25 primary election candidates on the same platforms and in the various descriptions below. Remember, early voting in Rhode Island starts on August 21st and goes until September 9th. Election day itself is on September 10th. You can find all that information you need, such as how you can vote, what district you're in, and even just more information about the election timeline on vote.sos.ri.gov. For Ryan Lukowicz, I'm Ray Bakari. Have a great day, everyone.